everyone, so let's move towards our today's topic, which is
nerve supply of anterior abdominal wall. When we were discussing about the anterior abdominal wall, the muscles of the anterior abdominal wall, I told you that all the anterior abdominal wall, all the muscles of the anterior abdominal wall are supplied by T7 till T12 nerve. There are some other thing as well which is supplied by these nerves. So if you remember that muscles are supplied by T7 till T12 nerve, it's very easy to memorize it, and the best thing is to memorize the nerve supply of the muscles of the anterior abdominal wall is this, कि आप ये याद कर लो कि T7 till T12 nerve supply करेगी muscles को. लेकिन साथ ही साथ these nerve will also supply to other structures as well, other skin, some muscles and some other organs as well. So we will discuss in this lecture. To memorize it easily, from T7 till T12, and another nerve is L1 nerve, which will supply the external genitalia. So these all nerves are divided into three groups. I have divided this group of nerve into three further groups. Number one, the first group is from T7, T8 and T9. First group consists of nerve T7, T8 and T9. So these nerves will supply the skin present above the umbilicus, and as you know, the anterior abdominal wall is from the pubic symphysis till the xiphoid process. So till xiphoid process, from umbilicus till xiphoid process, T7 till T9 will supply the skin of that area. Same like that, obviously, like I said, these all nerves are supplying to the muscles. Okay, same like that, obviously, T7 and T9 nerve are the thoracic nerve. Okay, and in that region ribs are present, intercostal spaces are present. So the T7, T8 and T9 nerve will supply the intercostal space, and then they will pass through the diaphragm, enter into the abdomen, and then they will supply to the anterior abdominal wall. This point is very much important. Okay, then the another group which includes only single nerve, that is T10 nerve. Okay, thoracic nerve 10. This nerve will supply the skin which is present around the umbilicus. This is the only thing you have to remember. T10 nerve is supplying only the skin of the umbilicus and around the umbilicus. Okay, the skin which is present around the umbilicus. Obviously it is also supplying to the muscles as well, but except skin, the muscles are included, which is supplied by T10 nerve. The last group, which includes T11 nerve, T12 nerve and L1 nerve. Now when we were discussing about the nerve supply of the lower limb, lumbosacral plexus, we had discussed about that L1 will form two branches, iliohypogastric nerve and ilioinguinal nerve. So those ilioinguinal nerve and iliohypogastric nerve will also supply the anterior abdominal wall. It will also supply the gluteal region, and it will also supply the external genitalia, which we will discuss in the reproductive lecture. But the point is, it's very important to memorize it that these nerve L1 from L1 iliohypogastric and ilioinguinal nerve are arising, and which will supply the external genitalia and the gluteal region, and the T11 nerve are supplying the T11 and T12 are also supplying the muscles of the anterior abdominal wall, but the L1 nerve is supplying to the external genitalia and the gluteal region. The T12 nerve, the another point regarding the T12 nerve is, which is also called as subcostal nerve. So it will supply to the pyramidalis muscle. Okay, pyramidalis muscle. Okay, so this muscle, pyramidalis muscle, is basically triangular muscle which is present below the which is present in the lower part of the abdomen. Okay, it's very small triangular muscle, but it is present in the anterior abdominal wall. So it is supplied by subcostal nerve, which is also known as T12 nerve. Now the last important point, these three nerves, T11, T12 and L1 nerve, will supply the region, the skin below the umbilicus till the pubic symphysis. Okay, now why I why I divided these nerve supply in the starting of this lecture. I told you that the nerve supply is from T7 till T7 till T12, and L1 nerve is also included. And then afterward I told you that these all nerves I've divided into three groups. Why? मैंने क्यों ऐसा डिवाइड किया? ताकि आपको नर्व सप्लाई स्किन की याद रखने में आसानी हो, क्योंकि मसल्स तो आपको पता है कि मसल्स कैसे सप्लाई हो रहे हैं. मसल्स तो सारे ही सप्लाई हो रहे हैं नर्व से. ठीक है, जो एक्सेप्शन केस था एक्सटर्नल जेनिटेरिया का, पिरामिडलिस का, मैंने वो बता दिया. लेकिन द मेन पॉइंट वाज टू रिमेंबर द स्किन सप्लाई, द क्यूटिनियस सप्लाई. So the first group, which includes T7, T8 and T9 nerve, they will supply the skin above the umbilicus. The T10 nerve, which is the second group, that will supply the skin around the umbilicus. And the third group, which is T11, T12 and L1, will supply the skin below the umbilicus till pubic symphysis, because obviously till pubic symphysis the anterior abdominal wall is present. Okay, so this was the whole topic regarding the nerve supply of the anterior abdominal wall. Till then, what you have to do is work hard, but study hard, and good luck. Take care. Bye bye. Thank you.